En 1996, le Dr Calvin Gutkin est devenu directeur général et chef de direction au Collège des médecins de famille du Canada. Depuis, Cal a mis toutes ses connaissances, son expérience, sa passion au service du Collège afin de mieux répondre aux besoins changeants des médecins de famille et de leurs patients, et ce, partout au Canada. À la fin de l'année, nous allons saluer Cal au moment de sa retraite. J'ai eu le privilège de travailler avec Cal pendant plusieurs années. Je suis certaine que son leadership, sa passion, son amitié et oui, même ses talents de chanteur nous manqueront. During his time with the CFPC, Cal oversaw the evolution and elevation of both the college itself and the discipline of family medicine. It was under his guidance that family medicine came to be recognized as a specialty in Canada. During his tenure, the number of college members as well as the number of staff more than doubled. Cal established Family Medicine Forum, which quickly became Canada's premier family medicine conference. Cal enhanced advocacy activities in the college and strengthened the value of family physicians across the country. Avant son départ, nous avons discuté avec Cal des années qu'il a passées comme chef à la direction du collège. Nous vous proposons une série en 4 épisodes qui relate les défis qu'il a affrontés, ses réalisations et quelques détails sur ses projets d'avenir. Please stay tuned for Part 1 of Conversations with Cal, In the Beginning, Part 2 of Conversations with Cal, Reaching the Milestones, Part 3 of Conversations with Cal, The Challenges We Face, and Part 4 of Conversations with Cal, The Next Chapter. Enjoy!
Cal, you've been with the college since 1996. Tell us what the college was like when you first became executive director and CEO.
Well, when I started in the college, and again the college had been growing over time, but it had reached a point where there were about 65 employees and there were approximately 12,000 members. Just to put that in perspective, we are now going to be looking at 140 employees, and we are past 27,000 members. So it's been a significant further growth over the last 16 to 17 years that I've had the privilege of being in this position. The college was in the stage of really having established itself as a credible, viable entity in the healthcare system, in the medical profession, in academic family medicine. The work that had been done in this college through the decade before, while Reg Perkin was the executive director, was outstanding. And it was an exciting time because you could see that there was quite a future that we were heading into, thanks to everything that had been done by the college leaders leading up to that time.
Tell us about the state of family medicine in Canada when you started with the college.
Well, as I mentioned, I think that family medicine was really entering a real growth spurt. I think the foundation had been very firmly established, and we were looking at the potential to really start to grow in terms of the role that family physicians would be playing in all communities across Canada, the credibility of family medicine as a discipline looked upon as the same as all other disciplines or specialties in Canada. And all sorts of pieces of that had to be put in place, and we had to continue to grow and build upon the foundation that had been established already. But that's what we were looking at. And we knew that we had a challenge at that time in 1996 to really grab this opportunity and to run with it in terms of what the potential was. The people of this country had clearly identified the fact that if family physicians were available in their communities, they preferred to have a family physician as their prime caregiver. And the access point through family medicine to all of the other very important parts of the healthcare system with other specialties, with other healthcare professions, but the family physician at the center of it. So we had to be sure that we had a discipline that was training family physicians to be ready for that, be it in rural communities or urban communities and all the communities in between. We had to be sure that we had the supports in the practice environment to be able to enable family physicians to commit to to their patients and to commit to a career that included lifelong learning, so that they were always going to maintain their competencies to be able to deliver the care needed for the people of this country.
So, what were some of the main challenges that the college faced during your term as Executive Director and CEO?
We saw a drop-off in the percentage of graduating medical students who would be selecting family medicine. We felt this was critical, not just for our own survival, but for what has been shown by evidence to be so important for the people of our country in terms of receiving their care. I mean, Starfield and others have shown clearly that the thing that leads to the best population health outcomes is having access to a primary care family physician. A family physician providing primary and secondary care is essential in a continuing care relationship with patients. If we dropped off in the number of family physicians we were actually producing, then we're probably looking at compromising the future of the quality of healthcare and healthcare outcomes for the population. So that was a big issue, a very big issue, and one of the goals that we've had throughout the last number of years that I've been part of the college through this position as something we had to really address. We had to make sure that we not only supported those already in practice, but that we really did build a future by attracting graduating medical students to our discipline. And building our chapters has been another major priority for us. And again, not new. This was recognized in the generations before, but this was a time where we really had to look at this. And it remains a major priority for this college to strengthen every chapter in every part of the country.